Hello everyone, my name is Erica McCall and today I'm going to be talking about antimicrobial resistance. So what exactly is antimicrobial resistance? It's when a bacteria mutate or changes in a way that the antibiotic that was able to kill it can no longer do that anymore. So this usually happens when an antibiotic is commonly used and the bacteria has time in order to change so that they can protect themselves from that antibiotic, so it won't work anymore. So when you go to the doctor's office, what do you usually expect to get out of that visit? You're not feeling good, you might have a stuffy nose, you might be thinking you have a cold, but you aren't sure. Are we going to think that the doctor is going to tell us to go home and just get some rest and drink a lot of fluids? Probably not. We want an antibiotic, right? Because that'll make us feel better. This may be good in some instances, but not every single thing can be treated with an antibiotic. And I'll tell you more about that on the next slide. So how is this happening? Well, antibiotics can only treat bacterial infections, so something like streptococcus pneumonia or an MRSA skin infection. If you have a viral infection like the common cold or the flu, an antibiotic won't help. The same thing happens with fungal infections, so something like athlete's foot or a yeast infection, an antibiotic won't work. So, this is just showing that it won't help with a fungal, a viral, but if it's a bacterial infection, an antibiotic can help. Why is this a problem? Well, we have a limited supply of antibiotics. When antibiotics were first discovered with penicillin, we were able to find different ways to get antibiotics to work. We found a lot of them in a pretty short period of time. But now it's becoming harder to find different ways for antibiotics to work, so we have a limited supply. And if we use all of those antibiotics, then we'll create these superbugs or these superbacteria that can't be treated. And this happens because bacteria can share their DNA with each other, so they can all become resistant to a certain antibiotic. So no matter what we throw at them, the bacteria will still be there and we can't do anything about it. So there are a couple different ways that a bacteria can become resistant to an antibiotic. So let's say an antibiotic will normally just go into the bacteria. That bacteria might find a way for when the antibiotic goes in, it can just spit it back out. And then the antibiotic can't do its job. Or some antibiotics look for a certain receptor on the outside of the bacteria. And it fits and the bacteria will die. Well, that bacteria could be able to change its receptor just enough so that when the antibiotic tries to find the receptor, it can't. So it's confused, so the antibiotic can't do its job. So what happens with antibiotic overuse? Well, antibiotics are indifferent to the bacteria they kill. So we have good bacteria in our systems and on our skin that we call a microbiome, and they're just harmless little bacteria. But when you take an antibiotic, that antibiotic kills both good and bad bacteria. And if the full course of antibiotics is not taken, some bacteria will survive. Some bad bacteria may survive and can become resistant to that antibiotic. So if you take that antibiotic, it'll kill both good and bad bacteria, but the bacteria that's left could become resistant and they could share DNA with each other, and then both of them are resistant. And then you could have a reoccurring infection that can't be treated with that same antibiotic again. Overuse of antibiotics also puts patients at an unnecessary risk for side effects. And I'm going to talk about a couple side effects here in a second. So the first one is Clostridium difficile. It was Clostridium difficile. So this causes the patient to have severe diarrhea. And in severe infections, the patient may have to go to the hospital in order to get treatment. Antibiotic use, whether it's appropriate or not, is the main cause for a C. diff infection. And some patients are at risk for recurrent C. diff infections as compared to others. That's why it's so important that we use antibiotics appropriately. The next disease state I want to talk about is sepsis. Now, we all may have heard of sepsis or septic shock, but we may not know what it means, and that's okay. So, sepsis is the body's extreme reaction to an infection that is severe and life-threatening. So, I have on the left here a couple symptoms that are common in a septic patient. So, confusion is a big one. Having a high heart rate, extreme pain, and the patient may be short of breath. So if these symptoms are found in a person, they need to be taken to the hospital immediately to be treated with broad-spectrum IV antibiotics and IV fluids. And these broad-spectrum or general antibiotics will continue until the hospital can get cultures back that will show the best antibiotic to treat that bacteria that's causing the sepsis. With an increase of antibiotic resistance, it makes it harder for healthcare providers to know which broad-spectrum antibiotic to use. So how can we help slow antimicrobial resistance and protect ourselves? First and foremost is washing your hands. Proper hand hygiene is one of the best ways to prevent an infection. Just doing it right after you use the bathroom or washing your hands before your meal is a great way to prevent an infection from occurring. The next is getting recommended vaccines. So vaccines are an amazing tool that we have now. They can prevent or reduce the severity of an infection from occurring. Making sure that we need the antibiotic. So, just to reiterate, viruses and fungal infections will not respond to antibiotics. Only bacterial infections will. If you have any questions about the medication that your doctor prescribes, you can ask your provider or you can ask your pharmacist. That's why we're here. We're here to answer any questions that you may have and to make sure that you're taken care of in the best way. And with this, making sure that you have an updated allergy list with both your doctor and your pharmacist is important because we don't want to give you a medication that will put you in harm's way. And if you do get an antibiotic, please do not share it with others. That antibiotic is for your specific infection, and the full course of antibiotics is needed to be taken. Which brings me to my last point, taking the full course of antibiotics. Even if you feel better after a few days, there are still bad bacteria in your system that need to be gotten rid of. And the only way they can get gone is by taking that full course of antibiotics. So what are healthcare professionals doing? So across the country, in different hospitals, there are antimicrobial stewardship teams. And stewardship is just a big word that means taking care of something that is really important. And making sure that we're using antibiotics appropriately is a very important thing because we don't want to create those superbugs, right? So these teams include doctors and pharmacists, nurses, microbiology, infection control, and so many others that are working to minimize the unnecessary use of antibiotics. So how do they do this? Well, they work to make sure that the best and safest antibiotic is used to treat the infection. So you remember those cultures I was talking about? That's what we're looking for in an infection to make sure that we're using the best and safest antibiotic. They also make sure that the antibiotics are dosed correctly and ordered for the right amount of time, because we don't want to underuse those antibiotics and have a few bad bacteria left and then they become resistant, right? They also create formularies and guidelines to make sure that antibiotics are used only when necessary. And they measure the levels of antibiotic resistance and educate healthcare professionals the best way to prescribe these antibiotics. So these teams are really important in order to reduce or slow the resistance rate, right? So here are some of the references I used to make this PowerPoint, and if you have any questions, just let me know. Thank you for listening, and thank you for your time.